But there are two things that I'm passionate about this morning. One, why should you, if you're a woman, be planning a wedding with a man and be buying the things? I mean, like the two of you are doing things together only for him to dump you at the very last minute. I had two cases yesterday. In one instance, the man didn't even tell the lady that he was done with her, only to go and wed someone and then send the photographs of the wedding, send it in an email to her. She thought it was a joke, but yeah, it was real. I'm passionate about that. I will deal with that subject. How can we see through them? And then somebody said, they are like armed robbers. They don't tell you when they are coming to rob you. But ladies, we've got to see through. So we're discussing that subject. Another one that I'm passionate about is, why should women die in the process of giving birth? That's big. And that's what I'm discussing right now. My guest is Mr. Babantunde Ahonsi. He's with the United Nations Population Fund. He's a representative here in Ghana. And then Edith Annan is a focal person for maternal health at the WHO. Well, really, the WHO, or let me say, October 24th, which is today, marks the 69th birthday of the United Nations. And as part of their celebrations, they are launching two campaigns, one for education, the other for maternal health. We will get into education someday, but for today, because it's a Friday, I thought, let's do the maternal health. And that's what I'm discussing with them. They will tell us a lot more about their plans later this afternoon. So can I say good morning and thank you for the time?
Thank you for having me.
Yeah. So I read some statistics, over 3,000 women dying. And as I look through the other countries, I saw, you know, like Italy recording like 7 in a year. And then Ghana 350. That's huge.
Yeah.
You are on the ground, so why?
Well, I think the first thing is to say that Ghana has made some progress. As you know, in 1990,
with this number,
the world committed to reducing, as part of the MDGs, the Millennium Development Goals, the world committed to reducing by 75% the maternal mortality rate. So for each country, between 1990 and 2015, you're supposed to have reduced your maternal mortality rate by 75%. As we speak, Ghana has reduced by 50%. So we've come from 760 per 1,000 live births, 760 women dying per 1,000 live births, to 350.
Yeah, but
that's progress. Now,
not acceptable
course,
still.
It's not acceptable. No woman should die giving birth. Yeah. But the truth of the matter is some progress has been made. So the question ought to be, how do we accelerate the progress that has been made thus far?
Okay.
And that is where Ghana is, and that is where the United Nations has been partnering with the government of Ghana under what we call the MDG5. The MDG5 has to do with maternal health, improving maternal health. And we're partnering with the government of Ghana within what we refer to as the MDG5 Accelerated Framework, to ensure that Ghana continues to make progress. Now we know what is responsible for the bulk of the maternal deaths. And most of the causes of maternal deaths in Ghana are preventable. Actually, 2/3 of the deaths associated with pregnancy and childbirth, you can trace to 4 causes. Postpartum hemorrhage is a very big one. We also know that hypertensive disorders of pregnancy, essentially severe preeclampsia and eclampsia, is a factor. We know sepsis is a factor. We know abortion is a factor. And we know that if, for example, Ghana today were to increase access to effective family planning for women who are desirous of reducing the number of births that they have, of delaying the birth, or of stopping. That is, we are meeting the needs of women who actually want to use family planning. If Ghana were to do that, there would be a significant reduction in maternal mortality. Because if you don't get pregnant in the first place,
then you will not die giving birth.
And so all of the deaths associated with abortion, for example, will be effectively eliminated. The deaths associated with what we refer to as high-risk births. We know, for example, with maternal deaths, that most of the women that die either when they're having their first births, okay, or they're having births at a very young age, or they're having what we refer to as later births. You know, they're older than 35, they've had 5 kids. So again, many of the women in this category, very young, and those having frequent pregnancies at later ages, have an expressed need to plan their families.
Okay.
And so if we gain them access, the other medical causes are fairly easy to deal with. We know how to get women not to die giving birth. But so the challenge is, how do you equip the healthcare delivery system so that those causes can be dealt with? And how do you prevent women from being in situations where they are at high risk of maternal death?
Edith, I've got to ask what you also know, because you do a lot of work on the ground as well.
Yes. No woman should die giving birth. No woman should die. As you have said, in other countries, the number is very small per 100,000 live births. But in Ghana, like you are saying, is huge. There are a lot of things that the UN, together with the Ghana Health Service, the Ministry of Health, have put in place. One is the MDG acceleration framework, which looks at family planning. It looks at service delivery. I mean, people should have skilled delivery. Skilled birth attendants should help them to deliver. And also looking at the infrastructure in the health facilities. How do we deal with emergencies? Are people prepared when a pregnant woman is brought in who needs blood, who needs some service, who has a high hypertension, the blood pressure is very high? How do we deal with that? The UN is supporting the Ghana Health Service. We've been supporting them with guidelines. We've been supporting them with some with medicines, especially for those who have eclampsia, that is hypertension. We've been supporting them with medicines. We've been supporting them with family planning commodities.
It's good that you went back to family planning. I want to stay on that subject for a while. I mean, we've been talking about it. A lot of women, and indeed men, are aware of the, I think, various family planning methods, except for, I don't know if to call them myths, but there are certain things associated with family planning. Somebody would tell you that when I'm on, I put on weight, but I don't even want to go there. Why I want to go is this. In the process, you know, when you go and have a child, when you go and give birth in any of the hospitals, if we can have people telling women about family planning at the labor wards, that would be good, because sometimes you go and you are still not aware of family planning until you have a challenge of how do I control the children that I'm having. So it looks as if we're not really addressing the problems at the point where we should.
I mean, efforts have been made, to be fair to the Ghana Health Service and other stakeholders that are involved in family planning. There is a growing recognition of the need to focus some attention on what we are referring to as postpartum family planning. So as soon as a woman completes delivery, to give her the information, the counseling, to review the options before
You see, because
her.
they still are aware of the pain they went through, the difficulties.
So that is happening, actually. That is happening. But I think what we need to move
I didn't experience that.
Well, we need to move to a higher level. Part of this is until you institutionalize it, that is, it becomes part and parcel of maternal health care delivery, and you back it up with the necessary commodities, the skilled workers to provide that, then it's very difficult to sustain. So one of the points we want to make, and we want to encourage the government of Ghana to take up seriously, is the need for the government of Ghana itself to put in more resources to family planning. As we speak today, most of the commodities that you see in the market on family planning are provided from external sources. I think a time has come that the government of Ghana must budget for and cash back the acquisition and distribution of family planning. It must also take the lead in providing the capacities for frontline health workers to give the information, the counseling, and so on that goes with providing these commodities. So we are hoping that in the next year, perhaps, Ghana would have a budget line. The Ministry of Health's budget will have a line for family planning, and it will actually, the money will be released. That would be the true statement of commitment. Are
you doing any specific work towards that, or you're just sitting back and hoping?
No, we're not just sitting back and hoping. There are many stakeholders that are discussing this, that are raising this with government. Every opportunity we have when we meet with our partners and counterparts in government, we put these issues on the table. Because the evidence is very strong. You know, I started with the simple statement. If a woman does not get pregnant in the first place, then maternal mortality is not an issue. And we have today a situation in which nearly a third, the actual figure is 26.4% of women who desire to delay or stop having children do not have access to effective family planning. That is what we refer to in technical jargon as unmet need for family planning. So we are not even trying to encourage people or persuade them to take on family planning. They have expressed a desire, a need, and yet they are not able to access the products, the commodities.
So Edith, you're a woman, you've gone through the process before. Do you think we should begin the education from the point where you're even getting married from the beginning? Because it looks as if nobody talks to you about pregnancy. They expect you to have a child or children when you're married, but they don't tell you the processes. So you go through yourself, you deliver, and you have to take care of the child yourself. I mean, of course, sometimes you get some sort of help, but then again, nobody in your family, hardly would anybody call you, sit you down and say, you have to space the children. Usually, once you have one, now everybody's asking, when is the second one coming?
Yes, Mama V, I agree with you that we have to start the education from school. Students are supposed to be taught about family planning. You know, young girls get pregnant and they want to abort their children. If they knew that there are some methods to prevent them from getting pregnant, then they would use the methods. But now the Ghana Health Service is doing very well. Even before when you start, like you go for antenatal care, they talk about family planning to you. It is not when after delivery that they start talking. They talk about family planning when you are doing your ANC. And I think that we have to start from the schools. We have to start empowering the girls to take care of themselves from the schools. And if we do that, I'm sure we can reduce our maternal mortality rate when we do that.
Okay. So do we know what is killing the women the most? Is it because sometimes they skip the antenatal care, they only go during childbirth? Or the other one that Edith mentioned about if you have high blood pressure, if you're not going to a particular hospital all the time, then they will not have your record.
Yeah. I mean, there are two broad ways to look at this. You can, we talk about the 3 delays. Actually, what maternal mortality is something that should not really be an issue if women get care promptly. When they should have it, from the right caliber of service provider, it shouldn't be a problem. What we have actually are 3 delays. First is at the level of the community. Is there a recognition that there is danger? So in some of our cultures, the woman's feet is swollen, and they tell her, oh, that's normal. Every pregnant woman's feet gets swollen. So recognizing the danger signal and the importance of acting quickly. We have all kinds of issues that cause delay there. Then when the decision is taken by the community or the family or the woman and her husband to seek care, you have all kinds of issues that can delay getting that woman to the point of care as promptly as possible. It could be poverty, it could be transportation, it could be all kinds of issues. Then you have delays in the service delivery point itself.
The
woman gets to the hospital and they are saying, but you didn't come here for your antenatal care. Why are you now coming here when you have problems? Or you need to get a card and register. A woman that has all the indications that this is an emergency should be taken care of immediately. And she might get through all of that, and the service provider, the health worker that is there, does not have the skill sets and the competencies to manage a situation. So it's a combination of things. But in terms of the direct causes, we know that the leading one for Ghana is postpartum hemorrhage. It's bleeding. And there are proven low-cost interventions, misoprostol, oxytocin. These are the things some of the UN agencies have been involved in supporting the government of Ghana to ensure that these low-cost proven interventions are available. Misoprostol is very cheap.
So what's the problem? Is it that the hospitals don't have them, or?
Very often. I mean, it's a combination of things, but in more cases than not, it is because by the time the woman gets to the hospital or to the clinic, it's almost too late. Doctors are not magicians. If you bring someone that is nearly dead to a clinic, what is the physician supposed to do? Which is why antenatal care is very important, and ensuring that the situation of the pregnant woman is monitored. So once you see that this is likely to be a complicated pregnancy and delivery, adequate care is taken. Most pregnancies go well. Pregnancy is not a disease.
Yeah.
So most pregnancies go well. So if you do antenatal care and the woman is monitored, then the system kicks in. So that once there are signs of complications, then emergency obstetric care kicks in.
So there's an experience a colleague shared. She went to one of our known hospitals recently. And you have to queue. That's the normal process. It doesn't matter if you came in at 6, you still have to, and you have to wait for the doctor to come in before you all start going to see the doctor, one after the other. There was somebody sitting in the queue, heavily pregnant. She was suffering, but she couldn't jump the queue. It was not until somebody else who was in front realized that somebody was having a challenge somewhere that they said, you know what, let's all stay and let her go. She just entered and delivered. Shouldn't nurses be going around to see who has an emergency within the queue so that they can jump?
Yes, I think that is what should be done. Now they have focused antenatal care where you have even though the health workers are not many, they are trying to get one nurse to attend to one individual throughout her pregnancy, so that you have somebody, even a mentoring, somebody who can advise you, who can counsel you and all that. And so this focused antenatal care tries to help with the one-on-one, so that you know that when you come to the health facility, this is the nurse who will be looking after you, so that you can go to that nurse to get the necessary attention that you need.
I hope it works, because sometimes some of the senior nurses think, especially because they've gone through the process of pregnancy and childbirth, whatever you're going through, you get over it, so just say it's normal. Even in the hospitals, it happens. It happens.
Now, the Ministry of Health is now doing a lot of supervision. The Ghana Health Service is supervising the staff so that things like that do not happen. They are doing quite well on that. And you know, most of the delays happen in the community. In actual fact, you know how our cultural beliefs are. People think that, like you said, pregnancy is not a disease. And so even when you are in pain and you have to deliver, they say you have to pound fufu and all that. And so some of our cultural,
you have to walk the
stairs and things like, yes, yeah. It's good exercise though, and it can help with the delivery. But sometimes we wait too long to go to the health facility. Yeah. Normally, you know that most of the childbirths also occur at night. Most children are born at night, and that is where most of the delay comes. You are looking for transport to get to the health facility. There's no transport. That is why now there's an interaction with the district assemblies to help with the GPRTU to also help to bring the pregnant women to the health facilities. A lot of advocacy is going on around that, so that that delay is mitigated.
I don't know if you've also realized that some women also don't want to go through surgery. They think everybody has to push. If you don't push, it means that you didn't deliver the child.
But those are part of the things that continuing public education can help to deal with. The example you gave of the woman on the queue, who clearly was transiting into an emergency situation. If most of the people in that room, waiting room or reception area, realized that, come on, there are signs of danger here, you don't need the health care provider to come into that waiting room for people to collectively decide that this woman needs to be at the head of the queue. So we need to constantly have this continuing education, continuous public education. And that, in fact, what I always tell people is that the role that women play by giving birth is a case of, you know, the highest form of social responsibility. They are responsible for the fact that society is ongoing and is able to renew itself. So you cannot, in the course of giving life, it's an outrage, actually, that we should have such a high number of women dying in the course of giving life. That is why the United Nations is very, very committed to ensuring that Ghana resumes and continues to increase its progress in reducing maternal mortality.
Yeah.
I think in the last 2 years we've seen some stagnation, and we're really concerned that the necessary push.
We don't want stagnation. Though.
We want the necessary push that will lead to further reduction. And there is what is called the Campaign for the Accelerated Reduction of Maternal Mortality in Africa, which Ghana, really jumped up to in 2012. And what it requires, what it entails, is that the districts, at the district level, the district assemblies commit to, every district more or less knows its maternal mortality rate level. And then the district assembly chair commits to that before the president and says, over the next 1 year, 2 years, we will reduce maternal mortality in our district to so and so. And every year, the president meets with them and says, give us an account of your stewardship. The media needs to get involved in this as well. The community needs to get involved.
Yeah.
You need to look at the commitments that each district has made.
So we can hold them.
And then you hold them to account. Because women are performing an extremely important role for the society and for the country in giving birth to life. And they should not be dying in the course of doing that. So we commend the government of Ghana for being part of this initiative. But we also want to appeal to the media to be part of the process of holding the district assemblies to account.
Okay.
Just hold them to account. They made the promises.
Yeah.
They were not forced to take on this.
I'll take a copy of what you have.
Actually, I will give you a copy. Because it's important to take it forward.
Yeah, but just before we wrap up, tell me about the launch that you have later this afternoon at 12.
Yeah, as you know, we are marking the 69th UN Day.
Oh, that's rude. Can I say congratulations?
Thank you. And one of what we are doing is to launch today a One UN advocacy campaign. So over the next 4 months, the UN, on a system-wide basis, will speak on 2 key issues that are fundamental to peace, security, and sustainable development in the world and in Ghana in particular, namely maternal health and girl-child education. That will be the focus. The idea is to draw attention to those 2 critical issues.
Okay.
Because unless we get more girls educated, we reduce the disparity between boys and girls in accessing and participating in education. Unless we reduce maternal mortality and improve women's health generally, we will not make progress.
I agree with you.
We will not make progress.
Yeah. We wish you well.
Thank you.
All the best this afternoon.
Thank you.
Okay,
I hope
so
you'll be there.
Yeah, one of my colleagues will be. So I've been speaking to Babantade Akonsi. He's a representative in Ghana with the United Nations Population Fund. Also Edith Annan, focal person for maternal health with the World Health Organization.